Here's my visual aid.
And you can see. Don't hit your son. Okay.
I gotta put my thing here. Okay, so imagine that you are a parent-to-be. You have waited almost 10 long months to meet your new baby. Ideally, you take your beautiful baby home, and you are joyful and relieved that they are here and that they're healthy. But once you get home, some time passes, and you feel empty, you're sleep deprived, you are sad for what seems like no reason. You don't want to eat, you don't want to sleep, and you don't want to do anything, even the things that you used to enjoy doing. Some days you feel nothing for the beautiful baby that you brought into the world. Postpartum depression is also known as PPD, and it's a very serious condition, and in some cases a deadly condition. It is typically defined as depression that a mother experiences in the postnatal period, although men can suffer from it too. PPD has been reported in 10 to 20% of new mothers worldwide. It can start the moment after a woman gives birth, or it can be the result of depression that has been developing throughout her pregnancy. However, it has been reported that the symptoms of PPD most often show up in the 6 to 12 weeks after birth. And as far as the symptoms of PPD, there are a number of characteristics of PPD, and just some of which include feelings of loneliness and isolation, hopelessness, spontaneous crying, withdrawal, fatigue, eating and sleeping disturbances, anxiety, and in some cases, people with PPD can experience intrusive thoughts, obsessive impulses, and suicide ideation. Because PPD can have such serious effects and implications, it is obviously important that we know what the risk factors are for it, which is to say what makes someone more predisposed to having postpartum depression. There have been countless studies on PPD, and one of the risk factors that has been associated with it include a woman not having the kind of delivery that she wanted, so having a C-section versus a natural delivery, or having a traumatic birth experience. A 2014 study published in the Journal of Psychiatry and Neurological Sciences showed that maternal attachment to her newborn was impacted in the case of a C-section. In addition, PPD rates are also higher in women who got pregnant unintentionally, are of low income status, or have little to no social support, and those who have suffered from mental illness in their past or have a family history of mental illness. And though these things can lead to PPD, sometimes a woman experiences PPD without experiencing any of these risk factors. In this case, PPD is purely a chemical imbalance in the brain. Oftentimes, PPD is caused by a combination of both outside factors and physiological factors. Certain medications, such as antidepressants and anti-anxiety medications, have been proven to minimize and treat the effects of PPD. And psychotherapy, which is also known as talk therapy or counseling, has also been shown to be very effective for those who deal with PPD. And as someone who suffers from PPD, I can tell you that having PPD is hell on earth. And I too possessed a lot of the risk factors for it, and I fell victim to it. But I also sought help, and as I just discussed, taking medication and undergoing therapy has helped me tremendously. And PPD is a very serious condition. I am very fortunate to have come out on the other side of it. And it goes way beyond having the baby blues or being hormonal. It's full of stereotypes and misconceptions. And because of this, women are reluctant to seek help. And because of this, it takes lives. And it is because of these reasons that I wanted to talk to you about PPD today. Thank you.
I don't think we're supposed to do that anymore. One down, one to go.